have a counseling service available via phone at 1-800-686-1578, and they are available to talk to you Monday through Friday, 7:30 to 5, and they're local here in Columbus. I'm coming to you from Columbus, but like I said, we are local in Ohio, so that hotline will be able to be answered by someone here in Ohio. In 2020, we are offering virtual counseling sessions, so unfortunately, we're not able to go out into the community and offer enrollment sessions face-to-face, but we are offering virtual counseling. So you can make an appointment to talk to someone via video conference. They'll be able to share the screen with you, and you'll be able to talk to them if you need counseling services. So I'm going to talk for about a half hour today about Medicare, about a few changes that are happening in 2021, and about what we do at OSHIIP. When I'm done speaking, I'll be able to take any questions that you may have related to Medicare changes or anything Medicare related. So I'll be happy to take questions at the end. So the first slide is our most important one. What is Medicare? So most people know that Medicare is a federal health insurance program that's administered by the Centers for Medicare and Medicaid Services. There's 3 ways that you can be on Medicare. Most people know when you turn 65 is when you can start your Medicare. So Medicare is available for people who are 65 and older. You can also be on Medicare at a younger age if you are disabled or if you're diagnosed with end-stage renal disease and a couple other disease states like ALS. So when it comes to Medicare, you have 2 options to be on Medicare. Now, most of the folks today are already on Medicare that we're talking to, but it is also important to know what you have. So you made a decision when you started your Medicare, but it's important to know what you have now so you know how it works and what changes you can make. So everyone is either on one of 2 options. And I like to think about these options as cards in my wallet. So you can see our chart here. We have option 1, which is 3 cards in our wallet, our original Medicare card, plus secondary insurance, plus prescription drug coverage. So that's option 1. Or I can be on option 2, which is a Medicare Advantage plan, which is 1 card in my wallet that encompasses all of my needs. It combines everything into 1 card. So you can be on option 1 or option 2. And as we go on through this presentation, we're going to break all of these pieces and parts down so we know how they all work individually. So original Medicare is broken up into 2 parts, Part A and Part B. On your Medicare card that everyone should have, we have your name, we have our Medicare identification number, and then we have those 2 parts, what they are and when they started. Usually they start at the same time. So it's broken up into 2 parts for 2 reasons. The parts cover different things, so your coverage is different depending on which part it is. And then also the cost structure is different. So as we all know, Medicare was never intended to pay 100% of Medicare costs. So the services you're getting, how that's paid for, is going to depend on what part we're talking about. So Part A is your hospitalization coverage. So this is your coverage when you're admitted into the hospital. So that's admittance into a hospital is covered under your Part A. That hospitalization coverage also covers your skilled nursing facilities, any home health care services, and hospice. All of that's going to be covered under your Part A. Part B is your medical insurance. So Part B is your outpatient services, your doctors and providers, your preventative benefits, and any durable medical equipment. All of that's going to be covered under your Part B. It's important to know that Medicare doesn't cover any non-medically necessary services, and that includes vision, dental, and hearing. So vision and dental and hearing are not going to be covered under your original Medicare. Original Medicare covers a whole host of preventative benefits. Those are covered under your Part B, and there's no out-of-pocket cost for most preventative benefits. There's hundreds of screening tests and procedures that are covered at 100% under this preventative benefit section. Some examples are the flu vaccine is a really big example. You might have seen in the news, CMS and Medicare are trying to get the word out this year that Medicare is highly recommending that everyone gets a flu shot this year. So if you're on Medicare, your flu vaccine is covered at 100% and 100% cost, so there's no cost to you. They're really recommending that people get the flu vaccine this year because they want to keep as many people out of the hospital with the flu as they can in order to keep those beds free for the COVID-19 patients. So please go get your flu shot this year. It also covers other things like the pneumonia vaccine, hepatitis B vaccine, diabetes testing supplies, welcome to Medicare physical and annual wellness checks. Just from being out in the community and talking to so many Medicare beneficiaries, personally, I think that a lot of people don't know about all the preventative benefits that are covered under Medicare, so I really encourage you to familiarize yourself with them. Every year in the mail, you get a book called Medicare and You Handbook. It has Medicare and You, it's a red, white, and blue book, and then it has the year on it. So the new ones say 2021, and you should already have gotten that or probably getting it very soon. And that's a really great resource for all these preventative benefits. And again, these preventative benefits, most of them are covered for no cost to you, no out-of-pocket costs. So how much does Medicare cost? Unfortunately, we're still dealing with those 2020 numbers. CMS has not released the new 2021 Medicare amount. So these are the 2020 numbers that we're talking about. As I go through this, I want to point out that most people have some sort of either supplemental coverage or they're on a Medicare Advantage plan, which we're going to talk about. So they have some sort of supplemental coverage that helps them pick up some of these amounts. So these copays, deductibles that we're talking about today, that would be your, or on this slide, that would be your cost if the only insurance you had was your red, white, and blue Medicare card. So first we're going to talk about Part A. So again, Part A is your hospitalization coverage. Most people do not pay a premium for their Part A. So if you've worked for 40 quarters or you were married to someone who worked for 10 years or 40 quarters, you're not going to pay a premium for your Part A. It's going to be premium free. However, there are deductibles and copays associated with Part A. So when you're admitted into the hospital, your hospital deductible is $1,408. So when you're admitted in the hospital, that is what you're responsible to pay. That deductible covers the first 60 days in a hospital stay. Now, most people are not in the hospital for more than 60 days, so usually that deductible covers that hospital stay. However, at day 61, if you are admitted into the hospital past that 60-day date, you'll start having daily copays. That hospital deductible also covers the first 20 days in a skilled nursing facility. So sometimes you'll be admitted into the hospital, you'll get discharged, but you're not quite well enough to go home and you'll need to go into a skilled nursing facility in order to get some rehabilitation services. At that time, you'll start having those daily copays at 21 days. So that deductible does cover that first 20 days, but then in that skilled nursing facility, you'll start having some copays at day 21. So Part B does work differently. So again, Part B is our medical coverage. So this is providers, outpatient services, doctors, specialists, all of that's covered under your Part B. You will pay a premium for your Part B. The Part B premium is currently $144.60. So that's what you pay every month for your Part B. If you're receiving a Social Security benefit, this is taken out of your Social Security check before you receive that in the mail. Or not in the mail, excuse me, into your bank. So some people think, oh, I don't pay a premium, but they don't realize that that's being taken out of their Social Security before they receive it. This premium can be income-based, so if you have a higher income, you may pay more for your Part B premium, and you may pay more if you were late enrolling. There is a late enrollee penalty of 10% for every year you delayed enrollment into your Part B. So if you don't have Part B yet, if you're newer to if you're just turned 65 and you haven't signed up yet, you want to make sure that you do that as soon as you can so you avoid having a late penalty. There is a deductible associated with Part B. So again, your deductible is what you pay in the beginning of the year for your care. And that's in 2020, that was $198. So that was your Part B deductible. Part B is essentially an 80-20 payer. So what that means is Medicare is going to pay 80% of all of your costs, and then you are responsible for 20%. So Part B has a 20% copay for all services covered under the Part B. There are Medicare savings programs available for folks who are lower income. These help pay your premium, your coinsurance, your deductibles associated with Medicare. So the income requirements for that are $1,456 a month. So if you're single and making less than $1,456 a month, you may qualify for some Medicare savings programs. If you or someone you know is going to qualify for these programs, you can call us at OSHIIP, that hotline number we talked about, and we'll show it at the end here, and that will will help you get signed up for those programs. Okay, so we talked about our original Medicare card. So that original Medicare card are Part A and B. Now we're going to talk about secondary insurance. So secondary insurance is something that you are given or that you can purchase that helps pay some of those costs associated with original Medicare. So again, Medicare essentially is an 80-20 payer. So these secondary insurance will help you pay your deductibles and your co-payments that we talked about. There's 3 ways that you can have secondary insurance. You can have group health insurance. So you might have worked for someone, or you may have worked for a union that helps supplement your Medicare in retirement. So that's going to work as a secondary payer once you're on Medicare. Or maybe Medicaid. So Medicaid acts as a secondary insurance to Medicare. So if you were on Medicaid, you turned 65, you qualified for Medicare, now Medicaid is going to act secondary to your Medicare. The third way, and the most popular way, and the way we're going to talk about the most today, is Medicare supplemental insurance. Medicare supplemental insurance is private insurance that you purchase from an insurance company that supplements your Medicare. This is also called Medigap or MedSup. So if you hear the terms Medigap, MedSup, Medicare supplemental insurance, all of that means the same thing. It's that Medicare supplemental insurance. Medicare supplemental insurance is if you're getting a lot of mail when you're turning 65 or as you go on your Medicare life, a lot of it is advertisements for that Medicare supplemental insurance. So Medicare supplemental insurance, again, is something you purchase from a private insurance company. And how it works is you pay a premium every month to have this insurance, and then you have little to no out-of-pocket cost as you use your insurance. So you pay a premium for it on top of your Medicare Part B premium to the private insurance company, but then as you go to use your insurance, you have little to no out-of-pocket cost. These plans also have no network, so you can go to any doctor or provider that accepts original Medicare is going to accept your supplemental insurance plan. These plans are standardized across the different insurance companies. So all of these plans are lettered. So there's A, B, C, D, F, G, K, L, M, N. And all of those letters offer different benefits. So those are plans and they vary slightly. The most popular ones right now are F and G. So we'll kind of refer to those the most. So if you purchase a plan G, for instance, from Aetna, or a plan G from United Healthcare, those 2 plans, regardless of what insurance company you purchase them from, are going to offer the exact same benefits. The benefit is going to be the same. The plan G is going to offer the same benefits regardless of what insurance company you chose it from. However, the premiums are going to vary from company to company. So how much you pay for that insurance is going to vary depending on which company you chose to go with. So the premiums are something called age-obtained premiums. And what that means is that you are going to pay the same amount as every other person your same gender and age in your county with that company. And that premium may go up every year, but it's only going to go up based on your age. It will not go up based on your medical history. So if you turn, you turn 1 more year older, you're going to pay the same as everyone that's that age now with that company, with that plan in your county. So they're called age-obtained plans. When you started your Medicare, you had a guaranteed issue period when you were able to purchase your supplemental insurance with no medical questions being asked within 6 months of starting your Part B. So you start your Part B, you're able to purchase supplemental insurance within that 6-month period with no medical questions being asked. Outside of that 6-month period, any company can choose to either decline to sell you supplemental insurance, or they can choose to charge you more based on your medical history. So if you've been on Medicare for longer than 6 months, it may not be possible for you to get a supplemental insurance company or plan since you're outside of that 6-month window. It's called a guaranteed issue period. There were some changes this year when it comes to supplemental insurance. The changes were a little confusing and there was a lot of chatter. I don't want to say gossip, but there was a lot of confusion between seniors and social groups about the supplemental changes. So we definitely want to talk about those. So in the past, F and C have been the most popular supplemental plans. So F is essentially 100% coverage. So if you paid your premiums for your F plan, you didn't have any out-of-pocket cost. It's extremely close to the G plan. The only difference between an F and a G is a G plan, you do pay your Part B deductible, which is $198 this year. So it's very little difference, but there is a slight difference. Congress passed a law a couple years ago that said effective January 1st of 2020, you will no longer be able to purchase a C or an F plan if you are not yet 65 as of January 1st, 2020. What's important to know about this is if you already have a Plan F or a Plan C, you can keep that plan. That plan is not going away. It's just no longer available for purchase for people who are starting Medicare as of January 1st, 2020. So if you're already on an F plan, if you're already on a C plan, you can keep that plan. They're just no longer available for purchase for people who are turning 65 as of January 1st, 2020. So I hope that clears up some confusion about that supplemental change. Okay, so we talked about the first two cards in our wallet with our option one. We have our original Medicare card, plus some sort of secondary insurance, plus prescription, or now we're going to talk about prescription drug coverage, that third card in our wallet. So prescription drug coverage through Medicare is called Part D. Just remember D for drug. And this is also offered by private insurance companies that contract with Medicare. And it's available two ways. It's available as a standalone drug plan, which is what we're going to talk about now, that third card in our wallet, or you can have drug coverage through your Medicare Advantage plan, which we'll talk about in a few minutes. The initial enrollment is the same as Part B. So if you're on a Medicare Advantage plan, you probably enrolled the same time you enrolled in your Part B. It's important to know, though, that this Medicare Part D plans, they have a open enrollment period from every fall from October 15th to December 7th. So I like to think about these Part D plans as a one-year contract. They start January 1st and they go to December 31st. And every fall from October 15th to December 7th, you have the opportunity to change your Part D plan. It's really important that we do this. And I'm going to tell you why. We call this the 3 C's of prescription drug plans: convenience, coverage, and cost. There is a huge variety of Part D plans available in Ohio. There are over 32 different plans, depending on what county you're in, that you can choose from for prescription drug plans. Every single one of these plans has a different formulary. What a formulary is that the prescription drug plan takes all of the drugs that are available in the United States and they say, here's how much this drug is going to cost on our prescription drug plan. Here's how much it's going to cost if you go to Giant Eagle. Here's how much it's going to cost if you go to Mark's. Here's how much it's going to cost if you go and get your drugs through the mail. And every single one of those plans is going to have a different formulary. So there's 32 different plans, which means there's 32 different formularies. So it's extremely specific based on what drugs you take, where you live, where you like to get your drugs, to see which plan is going to be best for you, going to be most cost effective for you. Very often, 90% of the time, a husband and wife are probably going to be on 2 different drug plans if they're picking the best plan for them. There's so much variety and it's so personalized what plan is best for you. It's also important that you do this every year, even if you haven't made any changes. So a lot of times people think, okay, I talked to OSHIIP 2 years ago. I still like to go to Giant Eagle for my drugs. I haven't changed what drugs I'm on, so I don't need to call them this year. I'll call them if I ever have any changes. You need to know that that plan can also make changes to their plan. So they might take your drug off of their formulary and make it more expensive. They might change their preferred in-network pharmacy. they might, change what kind of cholesterol medicine they like to cover in their tier 1 versus their tier 2. So just because you haven't made any changes, if you stay enrolled in a plan without checking it, come January 1st, you may be enrolled in a plan that's no longer the best plan for you because that plan may change. The plans and companies are required to send you their formulary every year through the mail, but you may get that formulary, you may look at it. They are very complicated. I mean, it is a listing of every drug and how much it's going to cost and what tier it's in and if there's quantity limits. So unless you're extremely familiar with the intimate details of your formulary, you might not know what to look for when you're looking for the changes. So even if you haven't made any changes, it's really important that you still call us at OSHIIP. You can go on Medicare.gov. We are doing virtual appointments. It's just really important that you contact us or do it yourself on Medicare.gov to make sure that you can look at that and make sure it's still the best plan for you. And again, that open enrollment period is from October 15th to December 7th. So that fall open enrollment period that we're in right now, all those changes take effect on January 1st. So you have plenty of time to look at it. Again, you can call us at OSHIIP. We're doing virtual appointments this year. We usually do in-person enrollment events all across the state. We're not able to do those this year, but we are doing a virtual appointment. So you can look at someone face-to-face and we can share our screen with you and we can do it that way. Or you can do it yourself at Medicare.gov. So there's a lot of ways that you can look into this. How much does Part D cost? The monthly premiums, all of this information, the monthly premiums, the deductibles, the copays, all of it is going to vary so greatly on which plan you choose. So there's 32 different plans, which means there's 32 different cost structures for those drugs. I will tell you though, we have some low premiums this year. So the lowest premiums, so the lowest monthly cost to be on a drug plan this year is $7.20. So if you're not on any drugs or if you're on very inexpensive generic drugs, you can get a plan this year as low as $7.20 a month. But they also go all the way up to $92 a month. And if you're on some more expensive drugs, maybe that's the best plan for you. So there's a huge variety with these drug plans and what's best for you. The annual deductibles also vary. There's a lot with 0 deductibles, and then they go all the way up to $445 in deductibles. So again, a huge, huge variance. There is catastrophic coverage still available. So if you reach $10,313.75 in total drug costs, you're going to reach catastrophic coverage, which means at that point, you only have 5% to pay of the retail drug cost. So again, a lot of things to consider. All these plans have a different cost structure and formulary. It's based on your individual drug needs, and they change annually. So again, it's really important if you leave here with one thing, just remember I need to call OSHIIP or I need to go on Medicare.gov, make sure that I have the best drug plan available for me. There is an extra help program available for people who need help affording their prescription drugs. These can give you reduced or no premiums, reduced or no deductibles, and lower copays. So if your income is less than $1,615 a month, you probably will qualify for one of these extra help programs. Give us a call at OSHIIP and we can help you with that. Okay, so we're back to our chart here, talking about option 1. We've all done talking about option 1, 3 cards in our wallet. Our original Medicare card, plus some sort of secondary insurance, plus prescription drug coverage. Now we're going to talk about a Medicare Advantage plan. So this is our other option, our option 2, which is a Medicare Advantage plan. Medicare Advantage plan, again, 1 card in our wallet, and this is offered by private insurance companies to replace original Medicare. So this is something that you're going to sign up for with a private insurance company. These plans are available to people who are enrolled in Parts A and B. So you still have to be enrolled in Part B, which means you're still paying your Part B premium. And these are restricted by service area, by county. And the reason for that is these plans do have those networks. So you either have an HMO or a PPO. So you do have those networks of doctors and providers that you can go to. There's no age or medical restrictions when it comes to Medicare Advantage plans. So anyone, regardless of their age or medical history, can enroll in a Medicare Advantage plan. These plans work more like the plans that you might be used to from when you were working from those typical PPO HMO plans, meaning that you're going to have copays and you're going to have networks with these plans. So we talked about the supplemental insurance plans. We talked about we're paying a premium, and then when we go to use our plan, we have no out-of-pocket cost. These have much lower premiums, so you're not going to pay as much every month. A lot of them have zero premium, so you're not paying an extra premium. But then when you go to use your insurance, you have out-of-pocket costs. So you might pay $5 to go to the doctor. You might pay $200 to get an x-ray. You might pay $500 a night when you're in the hospital. So there's going to be cost as you go. You're going to pay as you go. And then, like I said, these do have the network. So you have the HMO. An HMO is a health maintenance organization, meaning that it's a tight network. If you go outside of that HMO, you're not going to have any coverage. So it's a really tight network. The PPO is a preferred provider organization, meaning they're going to have a list of doctors and providers, hospitals they prefer you go to. And if you go outside of that network, it's going to cost more. So you're going to have more cost than if you stayed inside that network. There's a huge variety of Medicare Advantage plans. Almost every county in Ohio this year has over 30 different plans that you can choose from. All of those plans are going to have like different networks, different copays. So there's a huge variety. The good news about that is we can also help you look at these at OSHIIP and on Medicare.gov. The Medicare Advantage plans also have an annual open enrollment period. So just like we talked about with the Part D plans, these plans have that same fall open enrollment period from October 15th to December 7th, and then you can choose a new plan to start on January 1st. These plans include that Part D benefit. So you're not buying a separate Part D plan. It's in here. The reason why I like to point that out, so important, is because the same things that we talked about looking at your Part D plan every year apply to these Advantage plans because they have the drug formularies inside of them. So if you're on a Medicare Advantage plan, your plan is still going to have a drug formulary in it. So it's still really important that you check every single year from October 15th to December 7th that you're in the best Medicare Advantage plan for you. There's so many options with these plans. A lot of times, one insurance company, so let's say Anthem, let's say you're in Lorain County. You might have 5 different Anthem plans to choose from in Lorain County, and the only difference might be that drug formulary. So even if you're super happy with Anthem, you know their copays are great, you like their network, all of that's good, it's still really important that you're looking at that because the only difference between those 5 plans may just be that drug formulary. So you want to make sure that you're in the right Advantage plan for you to make sure that you're not paying more than you need to for those prescription drugs. So it's really important, again, that you're looking at this every single year. One of the questions we often get when it comes to people's Medicare is, what happens if I'm on one option and I want to switch to a different option? One of the things we want to think about when it comes to switching between the options is that guaranteed issue period we talked about with the supplement. So if I'm on a Medicare Advantage plan and I want to switch to a supplement, it's important to remember that there's no guarantee that I would be able to get a supplement. I may be able to. It depends on the company, it depends on your medical history, but that company can deny me coverage based on my medical history outside of that 6-month guaranteed issue period. So if I have a supplement and I want to move to a Medicare Advantage plan, however, I can do that during any time because during that open enrollment period, because that Advantage plan, remember there are no age or medical restrictions. So if I have a supplement, I want to move to a Medicare Advantage plan, I can do that anytime. If I have a supplement and I want to go to a different supplement, there's no guarantee that I would be able to do that. Again, that company can deny me coverage based on my medical history. If I want to move from an Advantage plan to another Advantage plan, I can do that. That's what that open enrollment time is for. So I can do that in the fall to start on January 1st. Again, if I want to move from a Medicare Advantage plan to a supplement, there's no guarantee that I would be able to get a supplemental plan. This is a really great chart. This is a chart that compares the different options between the supplement and the Advantage plan. So when we're talking about a supplement, we're talking about original Medicare plus a supplement compared to a Medicare Advantage plan. So the cost. The supplements are going to cost more every month. I'm going to have a higher plan premium, but then when I go to use my insurance, I'm going to have little to no out-of-pocket cost. With the Advantage plans, I'm going to have a lower plan premium. A lot of them are 0 premium. But then when I go to use my insurance, I'm going to be charged out of pocket. Those Advantage plans do have the network, so you're going to have a network of doctor and providers that you can use, whereas the supplements do not have a network. I can go to any doctor or provider that accepts Medicare. Advantage plans do have some added benefits like vision, dental, hearing, fitness benefits. So some of those plans do have little extras that they can add onto their plans that may be enticing to you. I really encourage you, when you're looking at those benefits, to really look at what that vision and dental and hearing and fitness perks really are. When they say dental, it may not be the dental you're used to. It may not be as extensive coverage as you would like. So if you're looking at those Advantage plans, I really encourage you to really look deep into what those vision, dental, and hearing benefits are. With the Medicare Advantage plans, again, those drug coverage is included. So you don't have to purchase a separate Part D plan. Whereas the supplements, you do have to purchase that separate supplemental plan. So again, know your options, know what you have and how your insurance works. That way you can make sure that you're both getting all the benefits out of it and you're not paying too much. So know what you have and know what your options are. I do want to hit this really quickly before I wrap up and ask questions, is protecting yourself from unscrupulous sales practices. Very unfortunately, we're seeing a lot of Medicare fraud, and we're seeing a lot of unfortunate situations during this COVID time with everyone at home. So we really want to point out to people what is prohibited and what should not be happening, and really encourage you to report anything that you see that is not right. We partner with Ohio SMP, which is Senior Medicare Patrol and Pro Seniors. And their mission is to protect, prevent, and detect and report Medicare fraud. So you can always call them at 1-800-488-6070 if you see any of this. So the following things are prohibited. Door-to-door sales. No one should be coming to your door to sell you a Medicare product unless you've invited them. Giving out cash gifts or anything exceeding $15. High-pressure sales tactics. Misrepresenting a plan or giving out incomplete information. A big one that we see sometimes, unfortunately, is with the Medicare Advantage plans. Someone might tell you, oh yeah, that doctor's in network, that hospital system's in network, they're in our network. And then you go to use your plan and you find out that that wasn't true. That's misrepresenting a plan or giving out incomplete information. That's a big one that we see. The biggest one that we see is representing themselves as Medicare. No one from Medicare is ever going to call you. So if someone calls you and says they're from Medicare, that is a huge red flag. No one from Medicare is ever going to call you, either hang up or gives information from them and report it to Senior Medicare Patrol. No one from Medicare is ever going to call you. I also caution people to be careful about what they're getting in their mail. My dad is turning 65, and I went to go see them a couple weeks ago, and he gave me a big stack of mail that he got and said, I want you to look through this and tell me what I need to keep, what I need to, what's important. None of it was important. And a lot of it was very deceiving, making it look like it was officially from Medicare. And I know this happens. This is my job. I've seen other pieces of mail before, but I was shocked at how much some of this mail really tried to make it look like it was officially coming from Medicare. If you ever have any questions about if something is from Medicare, you can call 1-800-MEDICARE, and they have a record of everything that they've sent you in the mail, and they'll be able to tell you, yes, we sent you this, no, we didn't send you this, this is not us, this was us, or you can call us at OSHIIP and we can try to help navigate that as well. So that's a really big one that we unfortunately see a lot, is representing themselves as Medicare. Okay, and I'm gonna wrap up here and open up for questions, but before I do, I wanna again remind you that we do have our hotline available, 1-800-686-1578, Monday through Friday, 7:30 to 5. You're not gonna wait, you'll get someone on the phone local here in Columbus right away. I almost said in downtown Columbus, but we are all working from home, so they'll be spread out around Columbus, but our hotline is fully functional. They can help you do comparisons for open enrollment, and answer any questions, and we're open year-round, so we're not just open during open enrollment. You can also go to our website at insurance.ohio.gov, where you can set up a virtual appointment if you'd like to. You can email us at oshipmail@insurance.ohio.gov and ask any questions through there, or request a link to set up a virtual appointment. And with that, it looks like I'm getting some questions in the chat. So if it's okay with you, Lisa, I can just go ahead and start asking them, and then
perfect. And then we'll open it up. I'll unmute everybody after we answer these first questions in the chat, and then we can open it up for some additional live questions.
Great. So the first question is, do all physicians and hospitals automatically accept Medicare? The answer to that is no, but 99.9% of all physicians and hospitals in the United States accept Medicare. So essentially the answer is yes, they do. There's very few private doctors that do. Are there in-network and out-of-network providers when using Medicare? So original Medicare is everyone who accepts Medicare has accepted, it's essentially in-network. However, if you have a Medicare Advantage plan, that Advantage plan from a private insurance company, that's where you run into network. So it's important to know what you have to know if you have a network or not. Both of those questions are pertaining to Part A and Part B. Okay, so I hope that that answered it for you. And then if anyone else has any questions, they can. I think that Bob had a question. Yes, go ahead.
So I recently turned 65. I know you can't believe that. And I'm on my wife's health insurance plan. Do I sign up for Part A or do I wait?
Great question. I didn't cover that because I assumed everyone was already on Medicare. I apologize.
That's okay.
No, I would prefer that you did not sign up for anything. The reason for that is if you have an HSA account with your wife's insurance, you cannot have an HSA and also be on Medicare. Or you can't contribute to an HSA in your name. There's really no benefit to having Part A if you're not having Part B, so you're still using your wife's insurance, that's great. There's really no benefit to signing up for Part A, so we just tell people, just wait, and then when she retires and you both are going on Medicare, at that point you'll sign up for A and B at the same time.
Okay, thank you.
You're welcome. Are there any other questions anyone has?
Well, I do have one more regarding that. So when I do go on to Medicare and I come off her health insurance plan, do I have 6 months to do that?
No. Well, you have 6 months to purchase a supplemental insurance plan with no medical restrictions. I would encourage you, though, to sign up for Medicare 3 months before your wife retires. That way your Medicare starts immediately upon that retirement, because you don't want to have a lapse in coverage.
Okay, thank you.
So Medicare always starts on the 1st of the month, and then usually work insurance goes to the end of the month regardless of when the retirement is. So you want that to be as seamless as possible. So you really want to start that process 3 months before your wife retires, so your Medicare will start immediately following her work insurance lapse.
All right, thank you.
You're welcome.
Hi, yes, I have a question.
Yes.
Can you discuss credible drug coverage if I have original Medicare, I have Blue Cross Blue Shield, Anthem, federal employees health insurance, and then also my mom has now Medicaid. I'm having problems with the drug coverage. She has Anthem Blue Cross in the contract. It specifically states that she has credible drug coverage. Can you talk about exactly what is considered credible drug coverage?
When you say you're having a problem, where is the problem coming from?
The problem is coming from she's over there at Jennings, and she's Blue Cross is paying, the co-pays. Blue Cross is paying their portion, but the co-pays I keep getting bills for. And my understanding, it's either Medicare or Medicaid is supposed to pick up those co-pays. Am I correct if she has credible drug coverage?
Not 100% all the time. So it depends on like what level of Medicaid she has. The Blue Cross Blue Care, did you say she was a federal employee?
Yes, retired.
Retired. Yeah, that's probably where the problem is. And this would be the perfect phone call to call our hotline, and they can help you navigate all of this. The problem is that she doesn't have a Part D plan. She has a federal, it's within her federal employees plan. She needs to get a Part D plan, and then Medicaid will start covering more of her costs. She doesn't have a Part D plan right now. So
they've got prescription coverage in there, so I don't
Yeah,
understand.
it does. It's because it's a federal employee plan. It's a retiree plan, so it's not exactly the same. I would, can you type your email into the chat box, and I can email you and have someone call you that can help you navigate this more. This is it's kind of a funky case.
Yeah, I've been having a real problem with this, and I'm getting the bills, and I don't okay.
Yeah, just because it's a strange situation, and you're probably, you really need us to, we have like caseworkers who like dig deep on these cases and help people navigate it. And that's really what you need. Someone who really knows what they're doing.
Okay.
Cheryl, are you joining us by phone or are you connected to us online?
My iPad.
Oh, okay, perfect. Then you do see the chat box?
Yes.
Okay, perfect.
Yeah, if you put that in there, I'll email you, and I'll have one of our caseworkers can help you navigate this. I'm sure it's really frustrating, but it's just because it's pretty rare that a retired federal employee would qualify for Medicaid. That doesn't happen very often, so that's probably why no one's really figured it out yet.
Okay, thank you.
Yeah, you're welcome.
Do we have
any other questions?
I guess I have a question.
Sure.
Did you say that someone, there's no age restriction for someone applying for a Medicare Advantage plan?
Yes, I did.
So if someone is 55, they could apply for a Medicare Advantage plan?
Yes, they could. There's certain ones available for people who are on disability.
Okay, so if they were healthy and working and maybe on the open market purchasing insurance, would a Medicare?
You have to be on Medicare.
Okay, there we go. Okay.
So you have to be enrolled in A and B.
Okay. All right. Thank you. That's where the confusion came in. Okay.
Yeah. So under 65 or if you're not on Medicare, you'd have to go onto the marketplace.
Okay. Thank you.
Yeah. And I'm not seeing, did we get, Lisa, I'm not seeing that questionnaire putting her email in there. Do you have her contact information? Because if you have it, I can always contact her that way.
Yep, I do have it. I think it's because she sent it to the organizers. So
okay.
I'll send it to you right now.
Okay. Lisa can get that to me.
And I also put my home number on there too.
I see it. Yep, I have it right here.
I'll get someone to contact you and help you navigate that situation.
Thank you.
You're welcome. Any other questions?
Great. Well, Sarah, thank you so much for joining us today. It was very informative and a wonderful start for, and we're right in the perfect time period when everyone is starting to look at that. So thank you so much for really helping to simplify this for us all as well.
Yes, thank you guys so much for having me. And again, please don't hesitate to call our hotline or email us or set up a virtual appointment. We look forward to helping you.
Great.
Thank you. It was very good.
Everybody for joining us. And just a reminder, we do have our series continues next week. So we will be using this same link here, and you're welcome to join us. Next week's series will be Catholic burial traditions and pre-planning, and that'll be presented by Catholic Cemetery. So we hope that you'll join us next week as well. Everybody have a great rest of your week.
Thank you.
Thank you.
Bye-bye.
Thanks. Bye-bye.
Bye-bye.